My name is Representative Chris Pearson. I represent the eastern part of the Old North End here in Burlington, and I wanted to give you a quick update on the first 2 weeks of the 2012 legislative session. Today is Martin Luther King Day, so I took some time this morning to reread Letter from a Birmingham Jail, and I found it interesting to hear Dr. King talk about tension. In his case, he was talking about the tension that arises when they're creating actions, civil disobedience, and the necessary tension that that creates, and he is explaining that that tension is vital to making change. And it struck me in a different way. I mean, certainly the stakes are very different, but I really see that role, that as part of the role of progressives in the Vermont legislature. We're play by the rules, and we are polite and effective among colleagues. I think relatively well liked, but we definitely create some tension, and by pushing on issues, by constantly reminding folks of the populist position, it does create some tension with the Democratic majority, and more often than not, that tension breaks after a few weeks or a few months or sometimes several years, and we see change arise, and that's very exciting, and one of the reasons why I think it's essential to have this kind of alternative view be part of the process, and I'm proud to play that role. One of the interesting discussions we've been having as the session gets underway is many of us are pursuing something called the GPI, or Genuine Progress Indicator. This is an economic metric that is meant to be a counteroffer to the GDP, gross domestic product. Of course, that's traditionally how we measure the economy, and a lot of us feel that it doesn't do justice to asking or answering some very basic questions like, do we have a good quality of life? Are people happy? Are we content? Gross domestic product simply measures dollars spent, and the more dollars spent, the better off the measure indicates we're doing. Of course, when a family divorces, people spend money on lawyers, on setting up second households, and this is good for the economy under the GDP model. Irene, a disaster like Irene, ends up being a plus for the economy, but a lot of us, of course, would question whether or not that's really good. The Genuine Progress Indicator is used in Maryland, and rather than just looking at money, it tries to get at some of the bigger questions, like, what does it mean? What does it mean when we're spending money on things like gasoline and therefore polluting in order to get to work? What does it mean when we have a gross inequality among our economy? What does that do to our lifestyle? What does it mean when we're spending a lot of money on disposable goods versus renewable products? Same with energy, and on and on and on. So many of us are pushing to have the GPI it would be in parallel to measuring with the gross domestic product, but it might give us a little bit of a better picture about what we're getting out of the state's economy, and of course help us ask questions like, what do we want out of our economy? Another big issue this year that I will be playing a small role in is the Vermont State Hospital. After Irene, the hospital was closed because of flooding, and it's continued to be closed. This has been a hot political issue for a number of years, and no one's ever made a final decision. In a way, Irene forces us to make the decision. The proposal from the administration right now is to have a small centralized hospital rather than the 50-some beds in Waterbury, to more like 16 beds, and then some satellite options around the state. While a lot of us like the idea of more regional options, the question arises, can you get the proper scale of staff if you have just a 16-bed facility? In some cases, when patients are in a really bad way, they demand a lot of staff time, and that's necessary for staff safety, for the safety of other patients, and for the safety of the patient themselves. In a 16-bed facility, a lot of us question just the simple fact, will there be enough staff there when something goes awry to keep control of the situation? State workers, I know, are very worried about that. So the process, this question of the state hospital will go before several committees, including my own. And along the way, Committees will ask what other states have done or are doing on this question, and hopefully we'll dig down and be able to get beyond just what is some of the latest thinking to really see what's been working in states, other states, and what hasn't been working. In my case, I serve on the House Healthcare Committee, and committee time really is the bulk of what we're doing in Montpelier. So this year, the Healthcare Committee is charged with putting in place instructions, let's say, or direction that we got and all states have under the Affordable Care Act, the ACA, or the sometimes called Obamacare. The feds are requiring us to set up what's called health exchanges and also make pretty drastic changes to the way the insurance market works today. From my point of view, I'll be watching and playing a role, making sure that healthcare can be as affordable as possible, and hopefully making sure that we use the exchange as a transition into single payer or universal healthcare as we passed last year. We all agree, or the state has agreed, that that is our goal. We have to set up these exchanges as dictated by the federal government. But the question is, can we do it in a way that helps us transition? There are many, many systematic changes that need to happen around healthcare in order for us to get to a truly universal system. And the question, the puzzle that we're putting together, if you like, in the exchange is, how do we satisfy the federal government while also satisfying our own desire to move forward in a very unique and special way for this country? It's not unique in the world, of course. Every other advanced country has some kind of universal system, but it would be unique for this country. Certainly the Affordable Care Act at the federal level was not meant to be a stepping stone to any kind of single payer system, but there's a lot of very good and creative thinkers here in Vermont working to see if we can make that happen. Lastly, I will say one of the things that we've been watching closely is the redistricting process. This is where every 10 years after the census, we redraw legislative districts. This is very, very minutia, deep in the minutia. But of course, here in our neighborhood, in Ward 1 in particular, our district is very goofy. When I vote at Mater Christi, I'm not actually standing in my legislative district. The district line runs right through a neighborhood. So we're working hard to correct that, bring the neighborhood back together. There's been some back and forth. The census would suggest Burlington should have 10 seats, but that's a change, up from 9. And whenever you make change in the redistricting process, that means you fold another district somewhere in the state. Understandably, the 11 people on the committee responsible for that in the House is not eager to pick a colleague and have their legislative seat disappear. So it's a bit of a struggle. We're making some good progress, and we think we're getting there where Burlington will get 10 seats. And I hope that will mean that Ward 1 is kind of brought back together and we don't have these unnatural lines. So thanks for tuning in. I'll do these updates regularly, and you can follow me on Twitter. RepCP is my name on Twitter, certainly on Facebook and website, and of course just give me a call or drop me an email.